Welcome to the Pathways to Wellbeing documentation course, Child and Family Team Meeting Note. This course is one in a series of learning opportunities designed to help you familiarize yourself with pathways to well-being and continuum of care reform concepts, practice, and documentation. Pathways to Wellbeing supports youth by bringing together the child or youth and their family, behavioral health services, child welfare services, and other critical partners to support the safety, permanency, and well-being of youth involved with the child welfare system. As a behavioral health service provider in the County of San Diego, your responsibilities under Pathways to Wellbeing include creating and maintaining complete and accurate documentation of service activities. This course will describe the Child and Family Team Meeting Note and how and when to complete this note to document behavioral health services provider participation during Child and Family Team meetings. This short course is designed to introduce you to the Child and Family Team or CFT Meeting Note. You'll learn what it is, when the CFT Meeting Note must be completed, multiple ways to access the CFT Meeting Note, how to complete the CFT Meeting Note, and some helpful tips to support you along the way. The CFT Meeting Note is used to document a BHS provider's participation at a CFT meeting. CFT meetings are structured, strengths-based, and needs-driven, with the youth's and family's voice at the center. When billing for the CFT meeting, providers will utilize the Intensive Care Coordination, or ICC, Service Code 82. ICC Service Code 82 is also used for documenting ICC services occurring outside the CFT meeting. Please refer to the Intensive Care Coordination Note Documentation Microlearning for further information about the ICC note. CFT meetings can be requested by a member of the CFT anytime. In addition, behavioral health provider initiated CFT meetings for youth identified as eligible for enhanced services subclass occur within 30 days of establishing eligibility and at a minimum of every 90 days thereafter. Child Welfare Services, or CWS, initiated CFT meetings occur at critical decision points in the case, including at 5 days of removal from placement, or case planning, before jurisdiction, before court hearings, and when there is a change of placement. Probation-initiated CFT meetings occur prior to the youth entering foster care, prior to any significant placement changes, within 60 days of the court ordering placement in a short-term residential therapeutic program, or STRTP, or relative non-relative placement, every 90 days for youth placed in an STRTP, when there are any new charges or violation of court-ordered conditions, and every 6 months as needed or requested by the youth, parent, or any member of the CFT. The CFT meeting progress note must be completed whenever a BHS program staff attends a CFT meeting. After rendering the service, the note is to be completed and final approved in Cerner Community Behavioral Health, or CCBH. When more than one staff member from a BHS program attends the CFT meeting, each staff member is required to complete a CFT meeting note and document their unique role and contribution. The electronic version of the CFT meeting note is found and completed in CCBH. Form fill versions are available for programs that do not have access to CCBH and can be found, along with explanation sheets, on the RISE Pathways to Wellbeing and Optum San Diego websites. The CFT meeting note can be accessed in CCBH by logging on to CCBH with appropriate staff credentials, selecting the new Progress Note drop-down menu, selecting Individual Progress Note and Save, selecting the Standard tab drop-down menu, and selecting CFT Meeting Note to fill out the CFT Meeting Note, completing all of the sections. When completing all required billing portions of the CFT Meeting Note, programs will use the indicator of T-CFT Meeting. located in the billing section under the Provided To field. If using the form fill version, programs will use the indicator of T-CFT meeting, located in the billing section under the Person Contacted field. Complete all sections of the CFT meeting note. The prompts are useful guides for what to include in each section. Travel to from. Enter applicable location origin and applicable location destination. Participants. When completing this section, identify the role of each participant and their title if applicable. If any identified team member was not present, document the reason. This may also include a plan for including team members to be present at the next meeting. Functional impairment. Describe the current areas of the youth's life that are affected because of their mental health diagnosis. This also includes current mental health symptoms and behaviors, and child and adolescent needs and strengths, or CANS, actionable needs, which impact functioning and are the focus of the CFT meeting. Meeting summary. Outline the purpose of the meeting. Natural supports. New team members identified. Client and/or family goals and strengths identified, including CANS, centerpiece, and well-developed strengths. Permanency and/or stabilization of the youth and home. Progress toward goals. Presenting problem. Resources available. Actions taken since the last meeting, and the needs of the youth and family. Intervention. Each provider must document their unique role that differs from the other team members in the meeting. This may include active listening time, supported by what information was shared and how it can or will be used, and providing, planning, or coordinating services to the youth and family. This section can also include how the intervention will impact the client plan. Client response to intervention and observed behaviors during the meeting. Include the youth's observed mood and behaviors during the CFT meeting and their response to any interventions utilized during the meeting. Progress. Include the youth's progress and treatment and any barriers to progress toward meeting the client plan goals and objectives. This may also include any plans or interventions implemented for the purpose of mitigating identified barriers. If this is a wraparound CFT meeting, enter the phase of wraparound by choosing engagement, planning, implementation, or transition. If it is not a wraparound CFT meeting, leave this section blank. Overall risk. Enter information pertaining to client risks, such as suicidal attempt or ideation, self-injurious behavior, homicidal ideation, aggression, or other indicators of elevated risk. If the youth is deemed to be at elevated risk, the provider must document interventions, including safety planning. Additional information. When applicable, provide any pertinent information that was not included in other sections of this note. If the CFT meeting facilitation program was not utilized. For providers that have prior core approval to facilitate their own CFT meetings, the provider will complete and offer the CFT summary and action plan to the child and family team members, including the client, caregiver, CWS protective services worker, and/or the probation officer as applicable, and include the date the form was offered. Programs utilizing the CFT meeting facilitation program are not responsible for distributing the CFT summary and action plan. Some helpful tips to remember. VHS providers will always utilize ICC Service Code 82 when billing for CFT meeting participation. While attending a CFT meeting, utilize the CFT meeting note. For intensive care coordination with CFT members outside of or in between CFT meetings, utilize the intensive care coordination note. Multiple participants from the same VHS program attending the same CFT meeting may bill for the entire meeting time if each provider documents their unique role and contribution. If there are any questions, please contact your assigned Behavioral Health Services Pathways to Wellbeing Program Liaison. The Pathways to Wellbeing team roster can be found on the Pathways to Wellbeing and Continuum of Care Reform page on the RISE website under Contact Us. The URL is displayed on screen. BHS providers use the CFT meeting note to document their participation in CFT meetings. In this course, you learned what the CFT meeting note is and when to complete it, how to access the form in 3 different locations, how to complete each section of the CFT meeting note, and some helpful tips to support you in accurately documenting your participation in CFT meetings. We encourage you to review the other courses in this learning series. Thank you for attending this course.